The number of amputations is increasing.
Their solution was, the 3 doctors I went to, was to cut the toe off.
You need your foot, you need your leg, you need your hand, you need your arms.
They wouldn't speak up even if they knew. They played dumb.
My name is Dr. John Phillip. I'm director of the Bryn Mawr Wound Care and Vascular Center. Okay, the circulator boot, or also known as end-diastolic pneumatic compression, is a system of equipment which is delivering blood flow and improves the blood flow to the lower extremities. It brings oxygenated blood to the areas which are deprived of oxygen. It is composed of the hard casing, which is, we call it a boot, the plastic bag, which is the patient's leg is wrapped into this and placed in a boot. It has a timing device. It is also has a heart monitor, and the heart monitor is connected with the timing device and air compressor. What happens is the patient's leg is placed inside the plastic bag. The air is delivered into the plastic bag by the air compressor and is gently squeezing the leg, causing the compression of the portion of the leg. This is timed by the special valve assembly, and valve assembly is connected to the patient's heart and is regulated by the patient's heart rhythm. The compressions happen in the end diastole, or during the phase when the heart is relaxing, at the end of relaxation phase. Then quickly the pressure is released and the bag is deflated just before the heart is contracting in a systole. What is the benefit of using this device? Number one is, by repeated compression on the leg, we bring more blood into the area which is not receiving blood. And let's say the areas are maybe occluded or partially occluded. We feel it's like washing a dirty sponge, where water is supplied many times and eventually the sponge gets clean. We feel the same thing happens with circulator boot. It helps to wash out the debris of blood clots, the cholesterol, the calcium deposits, and helps to stretch a little bit the arteries, so there's improved blood flow to the area.
It started off by going to a blood flow specialist, because basically it's a heart problem and that it doesn't pump adequate blood to the toes, and so any cuts or openings tend to get infected. Their solution was, the 3 doctors I went to, was to cut the toe off, which kind of frightened me a little, and I decided, no, I gotta get some better advice than this. And most of the medical profession professed not to know about the circular boot or EECP, which is a similar treatment, but seems to be a little more vigorous. I was there with the EECP for about a month and a half or something like that, and decided to switch to this because we found out some more information about Dr. Phillips and the fact that they use medications as well as the circular boot mechanical treatment.
When I first came, I couldn't walk. I couldn't even stand to put my foot on the floor. I had 2 bad ulcers that was created from poor circulation. Then I had a real nasty scar that was created from surgery.
Mrs. Kennedy came to us in April 2008, and she came with an open wound in the right thigh area, in inguinal area and so on, and she had about 3 wounds in her ankle. She had a very poor blood flow to the extremity, to the leg, and there was the leg ulcers in the ankle area were complicated by MRSA infection, methicillin-resistant Staph aureus. She was placed on vancomycin IV. In a groin, we were treating her with a vacuum suction pump, which usually is helping for these conditions. The wound was open and was draining foul-smelling material. And the leg wounds also were fairly good size. Probably the pictures will show it. And then we encountered a number of complications. We did not know initially that she had already 2 heart attacks before she came to us. She had a bypass surgery, she had a stent placement, pacemaker. She had the episodes of pulmonary edema where the chest fills with a fluid. She could not sleep, waking up at night, short of breath.
I thank Dr. Phillips and Steve and Adam for what they've done and the patience that they had with me, and especially Dr. Phillips, because I've had I've been in the hospital several times from my heart, because that's what created the problem with my foot, was the poor circulation. And he's stuck with me, he's helped me, and he's found places for me to live here, because I have no relatives here. I know no one here. And I only came to his office through the front door. He took care of me, and it's been 10 months. I'm in my 10th month here right now.
And with procedures on her leg, we were able to open all these smaller blood vessels, which were very important to bring blood flow to the ankle. And gradually she was healing, and the wounds were closing. Now the wound is almost totally closed. I think she has a small scar, which is a tiny bit tender, but she's pretty much healed. She can walk on this leg. And she was told in North Carolina she needs amputation before she came. So that was one of the patients, like a last resort case, where she was about to lose her leg.
What I want to say is that if the doctor says that the only alternative is to lose your limb, seek some other information. And the doctors that you're going to, 9 times out of 10, they never heard of the boot treatment or any other treatment that can help you other than amputation. So get out on your own and get your friends or your children or any of your relatives to see if they can find something else to help you, because there is help out there. It's just looking for it. Tender there, but other than that, that's okay.
Slightly tender.
Right in there.
Okay. How's the walking?
It's pretty good. Slow, but it's good.
You can walk a little bit.
I can walk better.
But any shortness of breath when you walk, you feel?
Yes.
How far can you walk approximately?
Probably down that hall.
All the way?
All the way.
And then?
Then I'm short of breath.
Okay, you need to stop. How about the pain in the leg? Is pain coming first, or the shortness of breath?
The shortness of breath.
Shortness of breath.
I got no pain in my leg.
Okay. Let me check your
Just
blood pressure.
tiredness.
Whether it's the boot, the combination with the chemical treatment, or just the chemical treatment, I'm not sure of that. But it seems like it's headed for a successful conclusion, and that makes me happy.